Okay, moving on to the bones of the lower leg and the foot. The lower leg is made up of the two long bones, the tibia and the fibula. The tibia is the main weight-bearing bone. We can see the tibia here on down in the lower leg. It's a big, thick bone. This bone that runs down here, very solid structure, designed for weight-bearing. Very dense bone. The fibula, on the other hand, is also a long bone, much smaller long bone. It sits next to the tibia. It forms an articulation up here, the superior tibiofibular joint, and an articulation down here, the inferior tibiofibular joint. And then in between the two, there is a membrane, a very tough fibrous membrane called the interosseous membrane. Now, the fibula is a non-weight bearing bone. Its primary role is for stability down here at the ankle, and increasing the surface area for the attachments of muscle. If you fracture your tibia, if you break your tibia, weight bearing becomes very painful, very uncomfortable. If you fracture the fibula, weight bearing may be uncomfortable, although it's not unheard of that of individuals who fracture their fibula and continue to play sport, to run, to play football, to play rugby, completely asymptomatically. There's a number of palpable areas on the tibia and fibula. Most of them are at the top end or down here at the bottom end. The top end, we've got the two condyles of the tibia, the tibial tuberosity at the front and the head of the fibula. Down at the bottom end, the most notable points are the malleoli, the lateral malleolus here and the medial malleolus down here. Now, the two malleoli play an important role in stabilizing the ankle. They're like extended fingers, extended pieces of bone that grip the top bone of the foot, the talus. Now, if we take a section through the leg here we can see the anterior aspect of the leg. It's been skinned. This is the anterior aspect over here. There's the tibia. We can see the tibia. The fibula is buried in here between the anterior muscles, the anterior crural muscles, and the lateral crural muscles. But if we take a cross section through the lower leg, here we can see the tibia, the big weight-bearing bone, and over here, lateral to it, we've got the fibula. Again, just like in the thigh, there is a thick layer of fascia, a very strong layer of fascia that comes all the way around. It attaches, it blends in with the anteromedial border of the tibia here. It comes all the way around the anterior aspect, through to the lateral aspect, round to the posterior aspect. And periodically, again, we have septa, intermuscular septa, that separate out the muscles into their functional groups. There are three functional groups. There's the posterior compartment here, which has the superficial and deep compartments. There is a lateral group over here, which is the blue area that we can see, and that contains the peronei, the everters of the foot, the muscles that turn the foot outwards. And anteriorly here, we've got the dorsiflexor group. That's these muscles that we can see here. Compartment syndrome is a relatively common problem that we find down in the lower leg, especially in the anterior compartment here. Individuals who run, every time they impact the ground with their heel, the dorsiflexors have to work to lower the foot down to the ground, and they work eccentrically. And the increased metabolic demands in the area require increased blood flow into the dorsiflexors. That increases the pressure within that anterior compartment, and if the pressure gets high enough, we end up seeing a collapse of these of the blood vessels that run down in the anterior compartment, a condition known as compartment syndrome, which potentially can be quite a serious problem. Moving on down to the foot, so we've seen the bones of the lower leg. The skeleton of the foot is a very complex structure. It's a multi-segmented structure made up of at least 26 bones. I say at least 26 bones because different people have different numbers of sesamoid bones within the foot. We can see a little sesamoid bone here underneath the head of the first metatarsal. That's a fairly standard sesamoid bone, but occasionally we'll see sesamoid bones in the peronei, in some of the other flexors or plantar flexors of the foot of the foot and toes. The foot is divided up into, anatomically, is divided up into three anatomical regions. So if I drew a line here splitting the bones at this point, these bones at the back are collectively known as the tarsal bones or the tarsus. These long bones here These 5 long bones are known as the metatarsals. They've become famous since all these footballers, the David Beckhams and Wayne Rooneys of the world, that fracture their metatarsals. And then the toes of the digits are known as the phalanges. We have 7 tarsal bones, 5 metatarsals, and 14 phalanges, and as I said earlier, a variable number of sesamoid bones. The reason the foot is a multi-segmented structure is that the foot has to fulfill 2 significantly different roles, opposing roles. It has to be a mobile structure to be able to adapt to the surfaces upon which we walk. So if we're walking on a cobbled street, it can mould to the cobbles. So during the impact phase, during the loading phase of the foot, it needs to be a mobile adapter. But during propulsion, we don't want a mobile structure. We want a rigid structure. So it then has to go from being a mobile adapter to being a rigid lever, and it does this by changing its position. A supinated or an inverted, dorsiflexed and inverted position of the foot will lock the joints of the foot up. It puts them in the close packed position and it provides stability, whereas a pronated position of the foot unlocks the joints, it loose packs the joints themselves and leaves the foot in a relatively flexible condition. When we look at the tarsus, it's made up of 7 bones. These are fairly large and very stable bones. When we compare them to the carpus of the hand, they're much larger. They're designed for weight bearing and are therefore very, very strong. So there's 7 tarsal bones. They're arranged in such a way that they form the posterior part of the arches, of the longitudinal arches of the foot. So the medial longitudinal arch, the lateral longitudinal arch, and so on. These are the 5 metatarsals lying anterior to the tarsal bones. Okay, the first tarsal bone we're going to look at is the talus. The talus forms the highest point of the skeleton on the foot. Above the top of the talus here articulates, this bit is the bit that articulates with the tibia and the fibula to form the ankle joint or the talocrural joint. It's divided up into a body, a head and a neck. This is the body at the back. The bit that articulates with the tib and fib at the top is the body. This is the neck, and over here this rounded section is the head. Anteriorly, the talus articulates with navicular and part of the calcaneum. Inferiorly, it articulates with the posterior facets of the calcaneum. We can palpate components of the talus. In particular, we can palpate the sides of the neck and the sides of the head, and they're found just anterior to the malleoli of the tibia and fibula. Underneath the talus, we have the calcaneus, and the calcaneus is the largest of the tarsal bones. It forms the heel bone. It's a lever for propulsion for the calf muscles, and it forms the posterior pillar of the longitudinal arches. The calcaneus is clearly palpable. We can palpate the lateral side, the medial side, and the posterior side. But in addition to that, there's a number of tubercles and processes that we can also identify. On the medial aspect, we have a lip. There is this structure here, which is a lip. On the medial side, we have a lip. We have this structure here, which is a lip that supports the talus. It's called the sustentaculum tali, and its function is to support the talus on the medial aspect. On the lateral aspect, there is a clear tubercle that we can palpate. This is called the perineal tubercle, and it's there for to act as a pulley for the tendons of peroneus longus and brevis. Underneath, we have the lateral tubercle here and the medial tubercle, and then the whole posterior surface can also be palpated. The talus has a large number of articular facets, for cuboid anteriorly here, for the talus at the top, forming different components of different joints, the mid-tarsal joint and the subtalar joint. More bony points will be added to the talus, to the calcaneus, as we progress through the muscles and joints of the foot. The midfoot, so the talus and the calcaneus are often classified as the rear foot, The midfoot includes a number of bones. We've got this bone here, which is called navicular, the small boat. It's like a little ship. It has a big, significant tuberosity on the medial aspect of the foot. This is often where we get blisters when we buy new shoes. Lateral to that, we've got a bone that is shaped like an oxocube called cuboid. Again, this is quite a mobile bone, clearly palpable and relatively mobile. And then anterior to the navicular, we've got the three cuneiform bones: the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. And these three bones are quite solidly, quite firmly held together, and they form the mid part of the foot. They actually generate quite a significant ligamentous force to prevent collapse of the arches. Moving further anteriorly, we have a set of 5 long bones. These are classified as long bones. They may be small long bones, but they're still long bones. Yeah? So we have a diaphysis, a shaft. Over here we have the expanded ends, the epiphyses. These are the metatarsals. There are 5 of them, and these are known as the bases of the metatarsals. The first one articulating with the medial cuneiform. The second one, being the most stable of the 5 metatarsals, is wedged in a mortise formed by the 3 cuneiform bones. The third one articulates with the lateral cuneiform, and then the fourth and fifth articulate with the anterior surface of cuboid. These form a lever for the propulsive phase of gait, and at the distal end here we have the heads forming condyloid joints with the proximal phalanges. Further forward, we then have phalanges. The 4 lateral toes have 3 phalanges each, so proximal, an intermediate, and a distal phalanx. The second toe has 2 phalanges, a proximal and a distal only. When we come to do the practical components, we will be palpating these bony points and more. These diagrams are taken from Field, which is called from a book called Anatomy, Palpation and Surface Markings by Derek Field.